Yes.
Hi, my name is David. I'm a student nurse from TLU. How are you doing today?
Very good.
Good, good. Could I get your name and your date of birth?
My name is James Park and my date of birth is May 13th, 1962.
Okay, very good, very good. Very good, Mr. Park. Okay, so what we're going to be doing today is a head-to-toe assessment, and that's just going through your body systems to make sure everything is working properly, okay?
Okay.
All right, so before we start, do you have any allergies to foods or medications?
Not that I know of.
Good, good, good. All right, so let's begin. So what day of the week is it today?
Thursday?
Good, good. Do you know where we are right now?
In David Park's house.
Okay, good, good. And do you know the current president of the United States?
Joe Biden?
Okay, good, good. So the patient's level of orientation is good. His level of consciousness is alert. He's awake. I see he's well groomed. I see that he has very good hygienic practices. His skin tone is normal for his ethnicity. Okay. Let's see. I see his posture. He's sitting up erect and straight. He's not slouched. It's good. And when he walked in this evening, I noticed he wasn't using any mobility aids, no walking canes or walkers. Very good. Okay, so let's start by taking some of your vitals, okay?
Okay.
Your vital signs. So we're going to start with your temperature. Okay, 98.6, that is normal. Okay, next we're going to take your blood pressure, okay?
Okay.
Do you know what your blood pressure normally runs at? The normal is like 120/80.
Close to that, I think.
All right. Would you like to do your left or your right arm?
Right on.
Right arm? Okay, okay. So I'm going to be wrapping this cuff around your arm here, and it has to be kind of tight. So let me know if it's uncomfortable. How's that? Is that too tight?
No, pretty good.
Okay. Okay, make sure your legs are not crossed. Okay, good. Can you hold that right there? Thank you. Okay, you're gonna feel it kind of squeeze up on you. That's normal. Give it just a second. All right. Okay, let me get this off of you. So your blood pressure is about 120/78. That's very normal.
Great.
Okay. So now I'm going to be taking your pulse. I'm going to be taking that from your wrist here.
Okay.
Okay, just like right here. Okay, I'm just going to count for a few seconds. So your pulse is around 63 beats per minute. The normal is in between like 60 and 100, so you're in the normal rate. Okay. One more time. Okay. Okay. Very good. And there, I was actually getting your respiratory rate. So your respiratory rate is around 13 breaths per minute, and that is normal. Normal breaths per minute are between 12 and 20. Okay.
Okay.
Respiratory rate. Okay, and then lastly, normally we would get a patient's oxygen saturation level, but this facility, we don't have a pulse oximeter. So for today's sake, we will just say it's in the normal range of 95 and 100. I don't have the device for that one. Okay, are you feeling any pain today? Any pain around your body?
No.
Okay, good. So we got all your vitals, and that's it for the survey. So let's begin your skin exam, okay?
Okay.
All right, so I'm just gonna be looking at your, oh wait, before we begin. Gotta do hand hygiene before we touch the client or the patient. Okay, so I'm just gonna be checking the patient's scalp. Okay, just be looking here. Okay, make sure there's no lesions, there's no infestations. Okay, everything's normal there. I see the patient's skin, like I said before, matches the normal tone of his ethnicity. I don't notice any abnormal wounds, any lesions. I don't see any abnormal moles. Okay. Okay. Hair distribution. Not much hair on the patient, it's okay. I'm looking for edema in the lower extremities here, so I'm just gonna press in. Okay, patient has no edema, so there's no fluid built up, that's normal, that's very good. Okay, and I'm gonna be checking for his skin turgor to see how hydrated he is. Okay, so I'm just gonna be pinching this skin along your clavicle here. Okay, and it went right back to normal, so that is normal. He's doing good. You're well hydrated, that's very good. Okay, that was the skin test. Okay. And there's no redness in his skin, there's no jaundice, there's no cyanosis. That's good. There's no like redness or yellowness in your skin, no blueness. No abnormal bruising. Oh, can I see one of your hands here? I'm going to be checking for his capillary refill, see how well your circulation is doing. Okay, good. And then can you put your 2 index fingers together like this?
Okay.
Together at the bottom there. Okay, good. And I don't see any signs of clubbing, so there is good circulation going on through his hands. Okay, good, good. So that is the skin test. Let's move on to the head and the neck test, okay?
Okay.
All right, so again, I've already palpated, but now I'm just gonna palpate a little bit more further on the head. Tell me if there's any tenderness or pain. No pain anywhere?
No pain.
Okay, good, good. I see that the patient's face is symmetrical on both sides. I don't see any sign of drooping, no signs of cerebral palsy or anything like that. Okay, and I'm going to be testing for his cranial nerve 5 now. So I'm going to be placing both my hands on the sides of your face, and once you feel them, bite down and clench your teeth for me, okay? Okay, good, good. Okay, and now can you close your eyes for me? So now I'm going to be touching some areas of your face lightly, and tell me where you feel it, okay?
Okay. Forehead,
Okay,
chin,
okay,
and left cheek.
okay, good, good. You can open your eyes. So those are working very well. Okay. So now let's move on to the neck exam. The neck is symmetrical. I see that the trachea is midline. I'm going to be going behind you now and kind of feeling around your neck to see if there's an enlarged thyroid. I should not be able to feel it. Okay, I do not feel it. Can you swallow for me? Okay, good. Any pain?
No.
Okay, good, good. So that's good. And now let's test the range of motion in your neck, okay? Can you look to your left for me? Okay, back to the center. Good. To your right. Okay, back to the center. Look up. Good, good. Okay, back to the center. Now look down. Good, back to the center. Any pain?
No.
Okay, good. This is going to be pretty similar. You're just going to look side to side, but this time you're going to do it against my hand, so against some resistance. So turn your head for me. Good. Okay, the other one. Good, okay. And then one more test. I'm going to place my hands on your shoulders. If you can raise them against my resistance. Good, good, good. Okay, so that was the neck exam. Let's see. And then kind of lean all the way back for me here. Kind of scoot up. Scoot right to the edge here.
Mm-hmm.
No, scoot your butt here to the edge.
Okay.
And then lean back. Back straight. Neck back. And then look to your side here. Look to your right.
Mm-hmm.
Okay, I was checking for jugulovenous distension. I don't see any veins popping out on the side of his neck, so that is normal. Okay, go back to your normal seating position, sir. Thank you.
Okay.
Thank you for that. All right, so that, oh, okay. I missed something here. I'm gonna feel for your carotid arteries. There's one on each side of your neck. Okay, good, I feel that one. Feel the other one here. Good, good. Okay. And then lastly, on this part of the exam, I'm going to feel for his lymph nodes. In a normal patient, you should not be able to feel the lymph nodes. So if I do feel something, that means something is enlarged. So hopefully I do not feel anything. Okay, so if I can remove your glasses here, I'm so sorry.
No problem.
Okay, is it okay if I touch around your face?
Yes.
Okay, so this would be the pre-auricular. I do not feel a lymph node. The post-auricular, I do not feel any lymph nodes. Occipital, I do not feel anything. Jugulodigastric, I do not feel that one, very good. Submandibular, I do not feel it. Submandible, I do not feel it, good, good. Can you unbutton your shirt a little bit for me so I can get down to like your clavicle area? Okay. Oh, okay, good, good. Supraclavicular, I do not feel this lymph node here. Deep chain, deep cervical chain, do not feel it. Posterior cervical, I do not feel it. Superficial cervical, okay. Very good, very good. Yes, sir. Put your glasses back on, thank you. So I was not able to feel any of his lymph nodes, and that is good, that is normal. All right, so let's move on to a quick little eye exam, okay?
Okay.
Here's my pen light. Okay. I'm so sorry, can you
Glasses
remove your
off?
glasses one more
Okay.
time? I'm so sorry, can I touch the bottom of your eyelids here?
Go ahead.
Okay. Okay, patient's conjunctiva is nice and pink. His sclera is nice and white. Gonna look at his iris and his pupils. They are even on both eyes. Very good. Gonna test your eye motion. Okay.
Mm-hmm.
Can you follow my pen? Just with your eyes. Okay. Good. Good. No issues there. Now I'm going to shine a light into each of your pupils and just see how they react, okay? It might be a little bright, I'm so sorry. Okay? Okay, good, good. So both of his pupils reacted equally on both sides to the light. They constricted and got smaller, which is normal. So your eyes seem to be working just fine. You can put your glasses back on, sir. Thank you very much. That was just a quick little eye exam. Let me move on to your ears, your nose, and your throat, okay? I'm going to be feeling around the patient's ears. Is it okay if I touch your ears, sir?
Go ahead.
Okay, and let me know if you feel any pain or tenderness. Any pain or tenderness, sir?
No.
Okay, good, good. And I do not notice any redness or swelling or any abnormal discharge. So yes, his ears look great. Okay, I'm gonna test his ability to hear now. So I'm gonna do a quick little whisper test. I'm gonna whisper in your ear, and then can you repeat what I whispered?
Okay.
Okay.
I love Korean food.
Okay, good, good. Can you repeat these 3 words back to me? Light, tight, dynamite.
Light, tight, dynamite.
Okay, very good, very good. Okay, so your ears and your hearing, everything's looking great. Let me go for your, check your nose now. Do you mind if I feel just like around your nose to see if there's any tenderness or pain?
Go ahead.
Okay. Just lift the glasses up just for a second. Okay. Any pain, tenderness?
No.
Okay, you can put your glasses back on, sir. So I'm looking here, his nose is symmetrical to his face. His septum is in the middle. I'm also going to be looking at both of his nostrils here. Okay, with my pen light. Both nostrils are even on both sides. I don't see any redness or swelling or anything unusual there. Okay, can you plug one side of your nose for me and then breathe in and out? Okay, other side for me. Good, good. So now I'm just going to be testing your sense of smell, okay? So close your eyes and plug one nostril like you just did, and close your eyes. And tell me what you smell, okay? What do you smell? One more time. Yeah?
I don't know. Coffee?
Yes, yes. It is coffee. Okay. So your sense of smell is working just fine. Okay. So that your nose is working great. Let's go to your oral health now. Can you smile big for me? Show me your teeth. Good, good. Pull down your lips for me here. Can I see like your gums? Good, good. Nice and pink. His teeth are very healthy, nice and white.
Mm-hmm.
Good, good. Now can you open your mouth and stick out your tongue? Good. His tongue is midline. It's symmetrical. Okay. And keep it out for me and say ah. Good, good. You can close your mouth now. So that's good. The patient's uvula rose when he said ah, so that's good. You don't want food going down the wrong pipe, you know? Okay, very good. So that was the ears, nose, and the throat exam. So now let's move on to your respiratory exam, okay? Can you remove your shirt for me, please? Have you had any past history of respiratory diseases like asthma or?
No.
Okay, good, good. Do you smoke, use tobacco?
No.
Very good, very good. Okay. Okay, sir. So, kind of sit up for me in this chair so your back is not leaning on the
Back here?
a little bit, just a tiny bit more forward, right there. Okay, good, good. So I'm gonna be placing my hands on your back here, and whenever you feel my hands, can you say the words 99? Say it out loud, 99.
99.
Good. Again.
99.
Okay, one more time.
99,
Okay, good, and one more time.
99.
Good, good. So I was able to feel vibrations on both sides, which is normal. That's good. I'm gonna be checking your spine here. Patient's spine, I don't feel anything abnormal. I don't see signs of scoliosis or anything. Patient has great posture. Good, good. Okay, can I remove your shirt all the way now? I'm gonna be listening to some of your lung sounds, okay?
Okay.
Here, I'll just hang your shirt behind your chair here. Okay, thank you. Oh, and before I listen to the lung sounds, let me just see if you have any tenderness on the back of your chest here.
No.
No tenderness?
Mm-hmm.
Nothing.
Mm-hmm.
Okay.
No.
Good. Okay, so I'm going to be listening to his lung sounds with my stethoscope, with my diaphragm. Okay. Let's start here. So every time you feel my stethoscope reach your skin, can you take a big breath in for me and out?
Okay.
Good. Good. I'm going to go on the other side now. Good. One more time. Good. One more time. Okay, good, good. And kind of lift this arm for me right here. Breathe in. Out. Good, good. Okay, I'm gonna check the other side. Can you kind of scoot my way? Okay. Okay, breathe in. And out. Okay, good, good. Alright, so your lung sounds are sounding very normal. I didn't hear anything abnormal. No wheezing or crackling, so it looks like your lungs are breathing normally. Good. Good, good. Okay. So now I'm gonna move on to the cardiovascular exam, your heart exam. Okay. Any history of any heart disease?
No.
No? Have you ever had a heart attack?
No.
Good, good. So you're not going to be on any heart medications, right?
No.
Okay, good. Okay. So one more time, I'm going to be feeling your carotid arteries on your neck here. Okay, pulse is 2+ and normal. Again, one more time, the other side. Okay, pulse is 2+ and normal. Okay. And this time I'm gonna listen to your carotid arteries, okay? I'm gonna be listening for any bruits, and they sound like swishing noises, and I should not be able to hear them. So hopefully I do not hear them. And I'm gonna be listening with the bell. Okay, so once you feel this on your neck, can you breathe in and out, and then hold for me, like, and then just hold, no breathing, okay? So sorry. Breathe in, out, and hold. Good, good. I'm gonna do the same thing on the other side. Breathe in and out, and then hold. Good, good. So I did not hear any bruits, which is normal. That's very good. So now I'm gonna be actually listening to some of your heart sounds, okay?
Okay.
And I'm going to be listening to that with the diaphragm. And when listening to heart sounds, you have to listen at the 5 cardiac landmarks, okay? So I'm going to be starting here at the patient's aorta. So second, select right here. Okay, I hear S1, S2, lub-dub. The heart sound is normal. I don't hear anything extra or murmurs. I'm gonna go to the pulmonic. Same. Heart sound is S1, S2 is lub-dub, very normal. I don't hear anything abnormal. Okay, I'm gonna go down to the herbs point right here. Good, good. S1, S2 is lub-dub, normal, no murmurs. Okay, and the tri-stupid. Okay, S1, S2, lub-dub is normal, nothing abnormal there. And lastly, I'm going to listen down here, the point of maximal impulse. Okay, the S1 and S2 also lub-dub and normal. The heart is pumping just as it should. Very good. Okay, so that was the heart exam. We're almost done, Mr. Park, we're almost done. So now we're gonna move on to your abdominal test now. Okay, let's see. If I can have you, just sit up on the edge of this table for me for now, just sit.
Okay.
Okay. So how have your bowel movements been recently? When's the last time you went to the bathroom?
This morning?
Okay, very good. So no signs of constipation, no
No.
diarrhea, nausea, vomiting?
No.
Okay, very good, very good. Okay, Mr. Park, can I have you lay back for me?
Like this?
Yes, sir, just like that.
Okay.
So I'm going to be listening to all 4 of your abdominal regions, okay? I'm just going to be listening for any bowel movements, all right?
Okay.
Okay, I'm going to be starting down here at the right lower quadrant. Okay. Now the right upper quadrant. Good. The left upper quadrant. Good. And the left lower quadrant. Okay, good. I was able to hear bowel noises in all 4 regions, so you are digesting just fine, okay?
That's great.
I'm looking here at the side. Patient's abdomen is normal. It's not protruding or anything. I'm gonna look at it down here from this angle, and patient's abdomen is equal on both sides. Very good. I don't see any lesions, anything abnormal. Okay, good. Okay, so now I'm going to be feeling in your 4 regions of your abdomen now. And I'm just going to be seeing if there's any pain or tenderness.
Okay.
I'm going to be feeling to see if there's anything abnormal growing, no abnormal masses. Any pain?
No.
Okay, what about here?
No.
Good, good. What about here?
No.
Okay, what about here?
No.
Okay, I don't feel anything abnormal either. I'm gonna do the same thing, just a little bit firmer, okay? You're gonna feel a little bit more pressure. Any pain?
No.
Good. Any pain?
No.
Good, good. Any pain?
No.
Good. How about here?
No.
Very good, very good. And lastly, I'm gonna kind of percuss over his abdomen. The organs in here are hollow, so they should be very tympanic, not dull. Okay. Okay. Good. Okay, there doesn't seem to be anything abnormal with your digestive system down there. Very good. You can sit up for me, Mr. Park. We're all done there. And
Okay.
we're almost done. Just stay right there for me. This is my last test, okay? My last little thing. I'm going to be placing my hand on your back, and you're going to be telling me if you feel any pain or tenderness when I hit my hand, okay? Any pain?
No.
Okay.
No.
Okay, so that means the patient's kidneys are not enlarged. That's very good. Okay, very, very good. Oh, I almost forgot. I forgot one thing. Can you kind of turn your back towards me a little bit? Turn your back towards me a little bit. Good, good. Okay, okay. So when you feel both of my hands on your back, can you breathe in for me real big? Okay, breathe out. Good, good. So patient's lung expansion is normal. Whenever he breathed in, my hands split apart, and when he breathed out, my hands came back together. So, all right, Mr. Park, we're all done. It looks like you are very healthy.
Great.
Okay, and thank you for watching.